Good morning. Hi, my name is Angie. I'm going to be your nurse today. I just received orders from the doctor that we need to insert a Foley catheter on you. Before I get started explaining everything, can I get your name and date of birth? I see we got Taylor Gibson. Okay. That is matching what's on my bracelet. Date of birth 7/17/1972. Okay, great. And then allergies, I see compostine and penicillin. No latex allergy or anything like that. Okay, great. So like I said, the doctor has ordered for a Foley catheter today. It looks like you're going to be going down for surgery in a little bit, so we want to go ahead and get that in place. Have you ever had a Foley catheter before? Okay, you have. So just a little quick reminder, you know, this is a tube that is inserted into your bladder. It will help drain your urine. If you do feel like an urge or anything like that, we do want to make sure sometimes that tubing, if it were to get kinked or anything like that, could make you have that sense of urgency or spasm or something like that. So just let us know. But goal is put it in, have it in for surgery while you're on bed rest. Might leave it in for the next 24 hours or so. But once those orders are lifted, we want to get it out of you as soon as we possibly can. We'll drain your urine, so if you do have any questions, just let me know. If you have any pain or discomfort, also just let me know with that. So if you don't have any questions, I'm going to go ahead and get started here. I'm going to give you this extra blanket. Just try to provide some privacy. I know this is not the most comfortable thing to have done, but I will try to give you as much privacy as possible as we get ready to get going. Just pull these down, make it a little bit easier here in a few minutes. All right. Before I would do anything, if we needed to do any perennial care or anything like that, now would be the time before we got our tray and everything set up. Just take a peek. Everything looks pretty clean, but if we needed to clean you up, we would. I like to use this as a trash can, not necessary. Alright, pull these blankets down. Alright, before I get you uncovered, I'm going to raise your bed up just a little bit, bring you up to a working height here. Privacy as possible. All right, so we don't really need to do any perennial care. Things look good there. All right, so getting ready to set up my tray here. I removed my gloves, did hand hygiene. All right, I want this at waist level. So when I'm opening up my sterile field, I really want to think about where I want it on the table. I don't want to do a ton of movement of the paper if I don't have to. I want to grab the outside corner here, and I want to open away from me. I want to go across, and I want to use ballerina arms. I don't want to reach over my field, okay? So I want to make sure I try to go around my field. But once this drops below this side of the table, this area here is considered no longer sterile. So I do want to think about, you know, where do I want it? How do I want it turned? Sometimes I like to just hold it out, and then I can kind of figure out if I maybe want it square on my table. Now would be a good time to be able to do that if I wanted to. Not letting it drop. Just being gentle. Again, I don't want to reach over my field. I want to kind of go around. Making sure to only grab that drape there. You know, if you go slow, you can usually recognize when it wants to fold up, because if this corner folds back up in, that's no longer sterile, it's breaking my field. So I don't want those corners flying back into my field. So just going slow and setting up your field goes a long way in keeping that sterile, okay? So a couple different things. It does come with a set of sterile gloves. I like to bring my own. I'm not a huge fan of the ones that come in the kit, but I also like to just keep them. That way, if I do break field with my first set of gloves, I do have a backup set. Drape-wise, again, I can either choose to grab an outside corner of this, being very careful not to touch anything, or I can put on my gloves. So I'm gonna go ahead and do it with my gloves. So when I put on my gloves, I can do it a couple different ways. Sometimes I like to come to the edge if it makes it easier. But if I do that, I just have to understand I cannot turn my back on my field. So if I do that, I don't turn my back on my field to walk over here. Just staying in that 1-inch border here. If I had any rings, sharp rings or anything like that, I would take them off. I personally like to hold on to the edge of my field here in that 1-inch border. Makes it a little bit easier. These gloves are really stuck together, so I can kind of pick this up, manipulate it inside of my field, just making sure that those fingers stay inside that field, don't go outside that 1 inch. So once I can get my fingers up underneath that cuff, again, these gloves are really sticky, but that's okay. So I can step back. I want to pull my thumb way out of the way here so I can get inside there. Now I have on sterile gloves, I can pick this up. I don't have to be near as careful in picking this up because my gloves are sterile. It is sterile. I want shiny side to go towards the patient. If I'm doing this, I like to take the corners and kind of fold it in on my hands on my gloves, making sure it's not still touching my coat or anything like that, but it does help me to protect my gloves. I don't want to touch anything, so then I'm just going to kind of drop and place that drape here in between the legs of my patient. Okay, so I've dropped my drape. I don't want my fenestrated drape. When I drop, again, I don't want my hand to drop below my field. Here. So with lubricating with the male, depending on the type, some kits come with like a accordion bottle of lubricant. You can read policy. There are some that state you can insert the tip of that lubricant because it is sterile and actually insert the lubricant into the urethra and the penis. Or I don't do it that way, but it is a viable option, and there isn't anything wrong with that. I don't need this, but I am just going to set it out of the way. Sometimes also if that opening's not very big, I can just put the lubricant down in my tray. Making sure to lubricate the tip of my catheter. So this time I'm going to choose to just leave my field here versus it bringing down to the bed. Either are both fine. I just want to make sure that my cleaning supplies are here close, so I'm not reaching over my field to grab another swab when I go to clean. Since I got it here on the edge, I can easily clean, drop in the bag, and I'm not reaching over my field to do so. So this point in time, I'm going to grab the penis. If there was a foreskin, I would retract that foreskin now. So once I have grabbed the shaft of the penis, I'm going to clean in circular motions, going away from the opening, drop. So again, coming back, not reaching over my field, clean, drop. So I've cleaned with 3 swabs this time. Make this a little bit easier. I'm going to just drop this tray. I don't need it anymore. Making sure that the pieces that I need to remain sterile are in my hand here. I'm not dropping on the bed, but I do have this field here. All right, you are going to feel some pressure. I'm going to insert until I see urine, but with the males, we typically say to advance up to the bifurcation. Okay, I want to stabilize and inflate my balloon. pull back a little bit, make sure it is securely in place, disconnect. Could provide perennial care at this time if needed. Clean them up a little bit. Want to secure this to my patient's leg with a securing device. I want to drop this below the level of the bladder, making sure that there are no kinks or big loops, and it is over my patient's leg, not under. So I can cover you up now. This extra blanket. Is there anything at all I can get for you right now? No? Okay. Like I said, you'll be going down for surgery, and our goal is to get that out as soon as we possibly can.